The next bone of the skull is parietal bone. We have two parietal bones in the skull that form most of the cranial roof and sides of the skull. Each parietal bone is irregularly quadrilateral and has two surfaces, four borders, and four angles. This bone is a simple bone that you can imagine easily and learn it very fast. Okay, as I said, this bone has two surfaces, external surface and internal surface. External surface is convex and smooth with a central parietal tuber or tuberosity. Another thing that we can see on the external surface is temporal line. We have two temporal lines, superior and inferior, that cross on the external surface of parietal bone and form some arcs here. The temporal fascia is attached to the superior line, and the temporalis, it is a muscle, is attached to inferior line or inferior temporal line. When we move posteriorly, close to the sagittal or superior border, we can see a foramen, a parietal foramen, that transmit a vein from the superior sagittal sinus and connect internal cavity to external cavity or external surface of the skull. The internal surface of temporal of parietal bone is concave, and we can see the impressions of the cerebral gyri and also grooves of the middle meningeal vessels. In addition, a groove for superior sagittal sinus lies along the sagittal border and is completed by the groove on the opposite parietal bone. In addition, a granular fovula for arachnoid granulation is on the internal surface of the parietal bone near the sulcus for superior sagittal sinus. And these granulations are prominent in old age. When we have a skull that have old age, we can see better these granulations or this impression of granulations. In the left picture, we can see four borders of the parietal bone. The sagittal border articulates with the opposite parietal bone at the sagittal suture. The squamosal or inferior border articulate with greater ring of sphenoid bone, squamous part of temporal bone, and posteriorly articulate with mastoid bone. So we can conclude that the inferior border or squamosal border articulate with three different bones. The frontal border articulate with the frontal bone to form one half of the coronal suture. The occipital border articulate with the occipital bone, forming one half of lambdoid suture. In this slide, we can see temporal lines, obviously, and you can distinguish these lines on the external surface of parietal bone. In the left picture, at first we have one temporal line that extends posteriorly from zygomatic process of frontal bone. Then it's divided into two lines, superior and inferior. These two lines are on this external surface of parietal bone. Also in the right picture, we can see the temporal lines and trace them on the temporal bone. In this slide, we can see parietal foramen that transmit an emissary vein and connect the external surface of skull to a cranial fossa. In these pictures, we can see the anatomical variations of these foramen. We can see two foramen on both parietal bones, or one foramen, or no foramen, like picture C, or more than two foramen, like picture D. These are anatomical variations that can exist in the skull. Here, I want to show you a clinical anatomy of the parietal bone. We have a parietal tuber on the external surface of the parietal bone. In the sonography, we can estimate the age of embryo by biparietal diameter, or BPD. This is a very common and useful diameter that measured by radiologists in the sonography. Here we can see superior sagittal groove in both pictures, that it is on the internal surface of parietal bone. Near the superior sagittal groove, we can see foveolar granulation or granular foveola. That these impressions are more prominent in old age. Granular foveola are the place of CSF absorption in the cranial fossa. Okay, we have a superior view of the skull here. We have two sutures, coronal suture and sagittal suture. Coronal suture, as I mentioned and speak about it, is articulation between frontal and parietal bones. And sagittal suture is a line that one parietal articulate with opposite parietal and shape these suture. The kind of suture is synostosis and have a bony structure, and it is a very critical and important suture in the body and in the anatomical sciences, because we have a lot of sections of the body on this suture, or based on the sagittal suture. In this slide, we can see the situation of the parietal bone, both parietal bones in the skull, and we can see four angles of this bone. The frontal angle, or anterosuperior angle, is at the bregma. Where is the bregma? Bregma is situated where sagittal and coronal sutures meet, and marks the site of anterior fontanelle in the neonatal skull. The sphenoidal or antero-inferior angle lies between the frontal bone and greater wing of sphenoid. Its internal surface is marked by a deep groove or canal that carries the frontal branches of the middle meningeal vessels. The frontal, parietal, sphenoid, and temporal bones usually meet at a point called terion, which marks the site of a sphenoidal fontanelle in the embryonic skull. It is a very important point in the clinical courses, and the doctors should be aware of this point, and the traumas that can affect this bone, because in the internal surface of terion point we have middle meningeal vessels, and it is very important. The rounded occipital or posterior superior angle is at the lambda. What is lambda? A point that sagittal and lambdoid sutures meet, which marks the site of posterior fontanelle in the neonatal skull. The blunt mastoid or posterior inferior angle articulates with the occipital bone and the mastoid portion of the temporal bone at the asterion. In the internal surface of asterion, we have a impression that's related to a sigmoid sinus. In this picture, I show you the lambda, asterion, terion, and bregma points with different colors that you can easily recognize them and understand them. Temporal bone is an important bone in the skull, have different parts and participate in different regions of the skull. In two right pictures, we can see different views of this bone. The temporal bone is in blue and participate in the middle cranial fossa and posterior cranial fossa, and the upper picture we can see the external surface of the temporal bone, and in the left picture we can see different parts of this bone. We have four parts: a squamous part in red, petromastoid part in purple, tympanic part in green, and styloid process in yellow color. This bone contains the different parts of the ear, including middle ear and inner ear, and it's a very, very important in the traumas and clinical approach in ENT course. Okay, we can see a squamous part of temporal bone here. The squamous part has two surfaces, external surface and internal surface. Here we can see external surface of temporal bone, external surface squamous part of temporal bone. We can see in the center of picture a triangle, supramatal triangle that I show you in yellow, and some dot lines that are their its borders. Uh, one border is supramastoid crest, and another border is a part of external acoustic meatus. This triangle is important and is a kind of depression marking the position of the mastoid antrum. The mastoid antrum is medial to the triangle at a depth of approximately 1.25 centimeter. The triangle usually contains a small supramatal spine anteriorly. This triangle is important for surgeons because this is the approach to the mastoid antrum when we have a patient that has a infection in middle ear or mastoid antrum, and we should perform some interventions for this kind of patient. So this triangle is important, and you should pay attention to this triangle. It is important in clinical anatomy. Okay, and what about supramastoid crest? It is a crest that curves backward and upward across its posterior part, and I mean the posterior part of squamous part, and gives attachment to the temporal fascia. In another word, we can say that supramastoid crest continues upward along with temporal line. Or we can say continues posteriorly along the temporal line and anteriorly along the superior surface of zygomatic process, as you can see in the picture. Another thing that we can see here, it is a zygomatic process. Zygomatic process um, is a obvious process here, and has a two surfaces, superior surface and inferior surface. Superior surface continues posteriorly along with supramastoid crest, and inferior surface we have an eminence or tubercle named articular tubercle because it is in an anterior situation from the temporomandibular joint. A zygomatic process articulates with the temporal process of zygomatic bone and shape zygomatic arc. Another thing is mandibular fossa. Here that I show it with yellow star. Mandibular fossa participate in the temporomandibular joint. Mandibular fossa is limited in front by the articular tubercle or articular eminence that is a part of zygomatic process or inferior surface of zygomatic process. It presents an anterior articular area, I mean mandibular fossa, uh, and a posterior non-articular area. Anterior articular area formed by the squamous part, but posterior non-articular area formed by the tympanic part of temporal bone. As I said, this fossa participate in the TMJ or temporomandibular joint. This joint is between mandibular fossa and a process from mandible bone. Posteriorly, the mandibular fossa is separated from the tympanic part by the squamotympanic fissure. It is a obvious fissure, and you can see easily in different bones. Here we can see temporomandibular joint or TMJ, that it is between the head of a mandible or condylar process of mandible and mandibular fossa of temporal bone. We can see some numbers on the picture: 1, 2, 3, and 4. Number 1 is a head of mandible or condylar process of mandible bone. Number 2, mandibular fossa. Number 3, articular tubercle or articular eminence, that it is a part of zygomatic process or inferior surface of zygomatic process. And number 4 is postglenoid tubercle. It is small in human, but in some animals it is bigger and can act effectively in this joint. In this picture, we see the inferior view of the mandibular fossa. We have numbers 1 and 2 and A and B. Number 1 is mandibular fossa and number 2 is articular tubercle. Element A is postglenoid tubercle and B is a squamotympanic fissure. It is that fissure that divided the articular part and non-articular part of mandibular fossa. Non-articular part is in the posterior position and belong to the tympanic part, and articular part belong to the squamous part. Another part of temporal bone is petromastoid part. The petromastoid part of temporal bone morphologically one element uh, is described as a two parts, namely mastoid and petrous parts. In these pictures, we can see two views of the temporal bone, lateral view and medial view. When we see the lateral view of temporal bone, we can see the mastoid part as it is shown in purple. And when we see the medial view in the right picture, we can see the petrous part. So this is the different views of the temporal bone, and you should attention that just in the medial view we can see petrous part of the petromastoid part of temporal bone. The mastoid part of temporal bone is here. This part is a posterior region of the temporal bone, and we can see a mastoid foramen that have a variable size, number, and position, traversed by a vein, an emissary vein from the sigmoid sinus. The foramen may be in the occipital or occipitotemporal suture. It may sometimes be parasutural or may be absent here, and we don't have any foramen here. In this picture we can see mastoid foramen with the yellow circle. We can see a projection here, a down projection, mastoid process with red circle that exists here is a part of mastoid part that is a location of attachment of different muscles such as sternocleidomastoid. It is a very important muscle. On the medial side of mastoid process, we have a notch and groove that I speak about it in the next slides. In the left picture, we sectioned the mastoid part, and we can see mastoid air cells. These air cells can be infected in different patients, and the clinicians should perform some interventions for these patients. When we see mastoid part in the medial view, we can see two elements, mastoid foramen and groove for sigmoid sinus. Sigmoid sinus is one of the venous sinus of the central nervous system or the brain or cranial cavity, and mastoid foramen is here. As I said, this foramen is accessory foramen that connect the internal aspect of skull to external aspect, and connect the venous sinus of cranial cavity to some veins on the surface of the skull. We have some borders here. The superior border of mastoid part articulate with the parietal bone, and the posterior border articulate with the occipital bone. Here we can see an inferior view of the temporal bone. You should pay attention to the mastoid part and the mastoid process. Find mastoid process. Then move medially on the bone and find a mastoid notch. I show you with red circle. And medial to the mastoid notch, we can see occipital groove in yellow. In a mastoid notch, we can see the attachment of muscle, and in occipital groove we can find occipital vessels here. The petrous part is here in blue. In all pictures is blue, and you can recognize the petrous part of temporal bone. Um, the petrous part is a mass of bone that is between the sphenoid and occipital bones in the cranial base and contains the internal air or labyrinth. Uh, it moves superiorly and anteromedially in the base of uh, cranium and has a apex, base, three surfaces and three borders. The surfaces of the petrous parts are anterior, posterior and inferior. The apex is blunt and irregular and is between the greater wing of sphenoid and basilar part of occipital bone. When we see the apex of petrous part, we can see the anterior opening of carotid canal. The aspect of petrous part limits the foramen lacerum posteriorly, or we can say posterolaterally. We can see the anterior surface of petrous part here. In the left picture, um, I show you greater and lesser petrosal foramens. The lesser petrosal foramen is lateral to the greater petrosal foramen, and the same nerves transmit these foramens. In the right picture, we can see another things that are exist in the on the anterior surface, such as arcuate eminence, tegment tympani, and trigeminal impression. Uh, the anterior surface basically contributes to the floor of the middle cranial fossa and is continuous with the cerebral surface of a squamous part. Behind the apex is a trigeminal impression because trigeminal ganglion is here um, uh, in a adult individual. Between the squamous part laterally and arcuate eminence and the hollows just described medially, the anterior surface is formed by tegment tympani. What is tegment tympani? A thin plate of bone that forms the roof of mastoid antrum and also tympanic cavity. um, that these things are in the depths of petrous part. As you can see in this picture, the right picture section, and you can see what is it in the depths of petrous part. We can see tympanic cavity here, and above tympanic cavity, as I show it, it is tegmen tympani. Tegmen tympani is thin bone, or some kind of thin plate that forms the roof of mastoid antrum, and also tympanic cavity. In this picture, we can see anterior surface and posterior surface of petrous part. I show you arcuate eminence here with red color. What is arcuate eminence? Arcuate eminence is raised by the superior or anterior semicircular canal of the internal air, and you can find it on the anterior surface of petrous part. And about posterior surface, that contributes to the posterior cranial fossa. It is a simple surface that the opening of the internal acoustic meatus lies near its center. A small canal is here. That vestibular aqueduct lies behind the opening of the meatus, almost hidden by a thin plate of bone. This canal or canaliculus, or small canal, contains endolymphatic duct. The terminal end of endolymphatic duct is between periosteum and durometer. In this picture, I show you in green as named external aperture of vestibular aqueduct. A duct or endolymphatic duct transmit here and open in the posterior cranial fossa, where it is open between durometer and periosteum. And we can see a small impression here, and also on the natural bones. Internal acoustic meatus in the center of posterior surface of petrous part also is obvious here. I show you in circle, in blue circle. The inferior surface of petrous part is irregular, and is a part of exterior of the cranial base, or when we see the cranial base inferiorly, we can see the inferior surface of petrous part. Near the apex, we can see a quadrilateral area that is the place of attachment of some muscles. Behind this region is the large and circular opening of the carotid canal. I show you in blue circle and arrow that transmit it, and also we can see jugular fossa. Jugular fossa is have a variable depth and size, and contains superior jugular bulb that contain blood. Jugular fossa are in green circle. Now we can follow the course of internal carotid artery in both pictures. The artery first enters the thickness of the bone from the inferior surface of the petrous part and then exits from its apex and runs in the carotid sulcus on the lateral surface of the body of the sphenoid bone, as you can see in the right picture. The course of carotid artery is S-shaped. Again, you can see in both pictures, especially in the right picture, uh, because neurons are very sensitive to change in blood pressure. And since the internal carotid artery is one of the main sources of blood supply of the brain, the blood pressure in it must be adjusted to prevent damage of uh, neurons, and it is a very important point, and it is a very interesting in the anatomy of the petrous part and also carotid canal. Here I draw the internal carotid artery and show you in red color. We can see that this artery exits from the apex of petrous part and run in the carotid sulcus on the lateral surfaces of the body of sphenoid. And then a branch of the internal carotid artery named ophthalmic runs into the optic canal, and the other branch of internal carotid artery supply the brain tissue and neurons. As I said, the petrous part have three borders: superior, posterior, and anterior. The superior border is grooved by the superior petrosal sinus, another sinus that is in the cranial fossa. The posterior border together with occipital bone shape sulcus for the inferior petrosal sinus, and anterior border articulate with the squamous part of temporal bone and greater ring of sphenoid bone. In these pictures, we can see the superior border and groove for superior petrosal sinus in the left picture I show you in blue, and the right picture showed the total venous sinuses of the cranium, the communication between them, and the location of these venous sinuses. Tympanic part of temporal bone is a plate below the squamous part and anterior to the mastoid process. It fuses with the petrous part internally and appears between this and the squamous part, and forms the anterior wall, floor, and part of the posterior wall of external acoustic meatus. The plate The anterior surface of tympanic plate is the posterior wall of mandibular fossa. In other words, it is non-articular part of mandibular fossa, as I said in the past slides. The inferior border of the tympanic plate is sharp and shape a sheet around the styloid process. It is named vaginal process. We have a foramen here named a stylomastoid foramen that transmits the facial nerve and stylomastoid artery. In the left picture, I show you in red stylomastoid foramen, and in the right picture, I show you with blue arrow. I show you the tympanic plate in blue arrow. You can see this plate participate in the shape of external acoustic meatus. And the last part of temporal bone is a styloid process. I show you with black arrow. This process projects anteroinferiorly from the inferior aspect of temporal bone. Its length may vary in different individuals. And its proximal part is sheathed by the tympanic plate. I said about it that it is a vaginal process. In these pictures you can see a styloid process easily. It is a simple part of temporal bone and place of attachment of different muscles. In this slide you can review different parts of temporal bone, and in the front view and the lateral view we can see the different views of temporal bone. Also inferior view or base of cranium, we can see temporal bone and petrous part of temporal bone. You can review different parts of this bone and conclude this topic. Another picture for review the different elements in the temporal bone with different numbers. Please answer the numbers and study about the anatomy of temporal bone. In the first step, it may be difficult, but if you study more and more and giving help from different atlases and different references, you can understand completely this bone. Please discuss about the picture, uh, which section we have here, and name the different regions. Please think about it. The next bone of the skull is parietal bone. We have two parietal bones in the skull that form most of the cranial roof and sides of the skull. Each parietal bone is irregularly quadrilateral and has two surfaces, four borders, and four angles. This bone is a simple bone that you can imagine easily and learn it very fast. Okay, as I said, this bone